Hi, I'm Dr. Mike Jones, and you are watching Let's Talk. This is Global Education Ambassador Dr. Mike Jones. Happy Sunday to everybody. Thanks so much for joining in. I told you that we were going to continue our discussion with COVID-19 and education, and I decided to alter the program a little just to make sure that we have an opportunity to embrace our friend and brother from my hometown back in Surrey County, Virginia. Tonight, he is here with us live, COVID-19 survivor James Smith, and we're going to talk to him tonight and be able to have an opportunity to hear from him. His story is, I'm sure, one that we all want to be able to hear. First question I'm sure viewers want to know, and I want to ask you, is without disclosing personal names or business names, how do you think you contracted the virus? I know based on what I've seen and read on Facebook, and I've had an opportunity to look at Channel 13 Now News, local news in Norfolk, Virginia, who featured an article on you. They said that you were away working in New York in upstate New York, I believe, when you contracted the virus. How do you think you contracted it?
Okay, so yes, it's true. I was in upstate New York, and I was working there. I've been there since January of this year, and of course, as we know, the COVID-19 was not taken very seriously when it first hit our shores. A lot of people just went about their daily days. So being at work, I work in pretty close proximity with others. I am a government employee, so for that reason, why was that important? Because I'm a mission essential person, which meant I had to be at work.
Ah.
So there was a coworker of mine who contracted the virus. I'm not very sure of how or where, but he continued to work. And at the time, we didn't know he had it. And like I said earlier, we work close proximity. And I believe that's where I contracted the virus from. Once he noticed he was considerably sick, he coughed several times, which normally somebody cough is not a big deal.
Right.
But now seems like the first little sniffle or cough somebody gets, you get the side eye.
Yes.
And that's kind of what happened. We didn't really think anything of it, and mind you, it's still cold in New York. January, February, March, April. So we just kind of chalked it off as a regular cold. But because it was the virus, and once he got checked out, of course, had to let the job know. And that's how I knew he was positive.
I see. And I appreciate you sharing that information. For those people who are coming in tonight, we are live on Facebook. This is Dr. Mike Jones, Global Education Ambassador, talking COVID-19 and education with COVID-19 survivor, Mr. Jamie Smith from Surrey County, Virginia, the Tidewater, Virginia area. I want to give a shout out to your mom, Jamie, and your wife and your son. A shout out to your sisters and your brothers, all who I'm sure are so happy and grateful that you are doing fine and that you are well and alive.
Yes, that is correct.
So I want to ask you now, Jamie, can you describe some of the feelings? Because, we've all been watching the news and we've all been hearing different symptoms and asymptomatic things that people are talking about, the doctors and the researchers and the scientists. And unfortunately, we're getting contrite views and we're getting information that is consistently clashing from day to day, from hour to hour, minute to minute, second to second. Things seem to be very unstable in this unprecedented time of this COVID-19 era. I want to see if you can give us your experience, describe some of the symptoms that you may have experienced. You said that your coworker, you feel that he was coughing. It was not anything unusual at the time because people cough, right, all the time. People sneeze all the time, and we don't think anything of it. But talk to us about some of the feelings that you had and some of the symptoms that you had.
Okay, so I thought it was a very nice choice of words when you said just kind of conflicting. But when I let me just say this real quick. When I asked the doctor several days as I laid in the hospital, I said, so what can you tell me? He said, I really don't have an answer for you. He said, we don't know about this. This is so new to us, and we're learning this thing on the fly. I had to say that to say this. Now, from my experience, um, I was pretty much asymptomatic myself.
Okay.
So I did not share any of the high fevers, um, burning nose, um, a lot of those symptoms that a lot of people face. I did not have those symptoms. Um, I just noticed that one day at work, or a couple of days at work, my step was getting a little bit slower.
Mm.
And I just thought maybe I was tired because we work 12 hours a day. I just thought maybe, man, this job is really kicking my butt. But needless to say, um, my oxygen level was being depleted. So, you know, I didn't know that. Again, I just thought I was tired. So when I laid down on March the 31st to go to sleep, um, I had a hard time breathing that Sunday night. And so I called 911. 911 came, and they took
How
me to the
long did
hospital.
it take them to get there, Jamie, when you called? Because you were in New York, which has the highest rate of people being infected with viruses and the highest, unfortunately, death rate in America.
Right. Well, it did not take long at all. I'd
Oh,
say
good.
maybe 3 or 4 minutes,
Oh,
and they
wow.
were there. I was surprised myself,
Okay.
but being in the area that I was in, um, I can kind of see why it didn't take very long.
Hmm.
Um, but no, so they took me to the hospital, and once I got to the hospital, the intake nurses and doctors, they saw me moving kind of sluggishly, so they hurry up and put me on a gurney or a hospital bed, and they noticed, I guess they knew what to look for. My oxygen level was really low. Um, when I got to the hospital, it was below 70%. And
Hmm.
we know oxygen should be between 95 and 100. So I
Right.
was breathing on very minimal oxygen. So I was placed on oxygen. They took x-rays of my chest. The x-rays came back really bad.
Mm.
The nurse that took the x-ray, once she took the x-ray, of course, she could see the image right away. And she just said, "Oh my God," just like that,
Wow.
and ran out of the room to the doctor. And I would like to say what the doctor said, but I don't know if I can.
Okay.
But the
He had
doctor,
choice words. Let's just put it that way.
yes, he looked at the x-ray and was like, "Oh." And from
Yes.
that point, that's when they tested me for COVID. And
And when they tested you, what did that consist of?
it was a swab that stuck
Okay.
up my nose.
Hmm.
And oh my God, I felt like it went to the back of my head. It just
Oh.
kept going. And I was like, oh, when is it going to stop?
Mm.
But that's the test, and it's very uncomfortable, but it's something that we have to go through. And like you said, life as we knew it, that's over.
Yes, sir.
So if you're anybody planning on getting tested, just know unless they come out with a different test, you're going to get the swab all the way up your nose. But I found out 2 days later. Prior to that, I was admitted to ICU for 7 days. I stayed in the hospital for 8.5 days. Um, and 2 days later, that's when I found out I had COVID, and they were also treating me for the flu.
Wow.
So
And simultaneously, the flu and COVID-19.
yes, but
Wow.
fortunately or unfortunately, however you want to see it, I did not have any flu-like symptoms. You
Okay.
know, you get the cold, the chills,
Right, right.
the body aches. I didn't experience any of that. Um, and it amazes me because I did not experience a lot of the symptoms from that people stated that they dealt with dealing with COVID. And, you know, and that's funny you said it's very unstable. That it is. It's very unstable. It can affect me much different from the next person. So don't just take somebody's word and say, oh, well, they say they felt this way and I feel this way. It doesn't necessarily have to happen that way because I
Mm.
felt fine. I thought I was tired. Unfortunately, my wife, I talked to her and for a couple of days prior to that Sunday night, and she said, "Babe, you okay? You sure?" It's like,
Mm.
"Yeah, babe, I'm fine. I'm good. I'm just tired. We work a lot." And so she heard it in my voice. I guess she heard me just being a little winded,
Hmm.
um, and it all boiled down to that Sunday night, and that's it, man.
That's when when it all became apparent to you that something was awry and that you probably had something going on inside your body that was more than a notion, you
That's
know.
right. Yeah,
Yeah, but wow, that's very interesting, and that I appreciate you sharing how it can probably impact people differently, and and that goes back to what I was mentioning before. All of the information that we've received from the media, from doctors. I have a sister who's a doctor. I have friends who are in the healthcare profession, and I check in with them all the time, getting updates, asking them what are the signs, what do you see happening in the hospitals, etc. And it's exactly the way you are describing it. It seems like this is an ever evolving virus, and they really don't have a handle on all of the effects of it and how it surfaces. So I've been telling people, Jamie, stay home.
that's it.
I've
That's it.
been telling people,
Listen,
stay home.
listen. To verify the sol- the validity of what you're saying, I went into the hospital that Sunday night. Two gentlemen came into the hospital the next day.
Hmm.
Both of them passed away
From
from the
COVID-19?
from COVID-19. So when that happened, I feel very very blessed. I'm strong in my faith. You, you know my childhood. You know my
Of course.
past. Grew up in the church, so
Blessed
once all
memory of your father, the late Pastor Otis Smith Sr.
that's right, that's right. Um, once all of this started coming to a head, I called my wife, and my wife, she instantly started praying.
Mm.
And, the word spread like wildfire through my family and friends and people I didn't know. So on the faith side of things, there were a lot of people praying for me.
Mm.
Um, but in that instant, me there in New York alone without any of my family, there came a time where I really had to dig into my own faith. I had to pray for myself.
Right.
That's where it's important that not only do we follow the rules and guidelines of the land, but we really need a relationship with Christ because he was right there for me. Listen, I'll put this in perspective. My father, he got sick in Pennsylvania and had to have emergency surgery. And he said the last thing that he remembered before going in surgery was himself telling the Lord, Lord, I'm in your hands.
Mm.
And I told that myself, I remember that, and I told myself that. I said, Lord, I'm in your hands. And, from that moment, I didn't really feel frightened. I didn't really feel alone anymore. And it just kind of like that was the peace that came over me because it's a very frightening situation
Oh, I
if
can
you
imagine.
if you don't have that comfort. And
Absolutely.
I was just blessed to have my family call me. Oh man, they called me around the clock, man, and just checking on me, and I think that's what helped me pull through, that and their prayers.
I think that is a great segue to what I was going to ask you next. How did you pull through these hard times? And you said your faith in God, your relationship with God, your family and your friends supporting you, contacting you, calling you every day. And my goodness, you had two gentlemen who came into the hospital with COVID-19. You had been there how many days before those gentlemen came to the hospital?
I had only been there a day.
But
And
both
they
of them were in the same room as you or on the same
were
floor?
rooms next door.
Okay. And how did you know that they passed away?
So my nurses, I became very acquainted with my nurses who were, let me just say this. My nurses were God sent, man.
Wow.
They were from the doctors down to the nurses to the housekeepers. Nothing shy of amazing. Um,
I would say a miracle from God.
provided
Mm.
provided everything I needed, everything. Something as simple as I wanted some candy. I just felt like if I had some sugar, I would beat anything.
Mm.
And nurse went out of her way and brought me some candy, some chips, brought me everything I ever wanted.
Mm.
And that's just minimal stuff, but when you look back, it could have been I got nurses that did not care,
Mm.
that did not care, but they were God sent. They were angels, and it blesses me. I'd really like to go back and tell them thank you if I could. Um, so I'll share this. As I left ICU, they all cheered because I survived.
You're a walking, living, moving, breathing miracle. And as you said, it's all because of the divine intervention that was in place for the right nurses, the right doctors, the right healthcare workers, your sisters, your brothers, your wife, your son, all the people of faith who were praying for you, and everyone who was pushing you forward. And more important than that, it was your faith and your determination and your will to fight on because you felt that there was something greater on the other side of COVID-19. I just believe that. And that was one of my questions, Jamie. And as you know, you and I were preparing for our talk today. And I wanted to know from you, did you have the will to live? And when you felt like you could die because people around you in the room on the right and the room on the left were dying, you know, you had to have the will to live. You had to.
Yes. So some time ago, I'll say before I went to New York, there's a song that flipping through Facebook we saw and we liked, my wife, myself, my sister Sharon, and the song was called "Fight On."
I know exactly what song you're talking about. I've seen that video.
So I'm laying there in the hospital and I'm trying to find the video and I cannot find it. And so I text my sister Sharon. I said, Sharon, what is the name of that song? Where is it? I can't find it. And she just bawled out. She said, Lord, Jamie giving up. I said, no, I'm not giving up. That song just gives me the courage to fight
Mm.
and to listen to the words of that song, Fight On, just gave me the will to fight just a little bit harder to survive. And I'm blessed to be alive, man.
You
I
are.
don't know.
You are.
I don't know a whole lot more to say, but thank you, Jesus.
Yes, sir. That sounds good enough to me. That sounds good enough to me. And you are a fighter, you are a survivor. And, you know, I think about all the people, I too know people who have passed away from COVID-19. I know of a friend and colleagues. And, even in the school system, students who unfortunately have contracted the virus. Many of the people have survived and many of them have not. And, things could have been the other way, but there is a greater plan, and there's a plan that was greater and higher than our plan. And
Yes.
I definitely am happy to know that you can speak to people, even right now, those people who are watching our live Facebook feed, and those people who will share it, because I'm believing that people will continue to share this video for days to come, and even send it to someone who might be in the hospital right now battling with COVID-19. They may know someone who's
Yes.
battling with COVID-19, then they will share this video and they will see your face, James Smith, COVID-19 survivor, telling them to fight on, that
That's it.
they too can survive. That's what this is all about. That's what we need to do. We need to build a support network. And that's what my vision and my mission and my ministry, my assignment, whatever you want to call it, is to build a support network for the global community. We need to educate each other. We need to be informed. I want to ask you, Jamie, if you will continue to talk to those people who may have family members who have contracted the virus, and maybe they know someone that is dealing with the virus. Have you experienced survivor's remorse, or what advice can you give them in terms of helping them in this trying time?
So it's great to be alive. After
Amen, brother.
after
Amen.
surviving, um, life has a new meaning. Yeah, I love my wife. Yes, I love my kid, but just the thought of never seeing them again,
Mm,
it has a new meaning. Cherish them. Cherish your family members. COVID-19 is real.
mm,
Don't take it for granted. It is very real. Don't wait till it's too late. The parameters that are already set in place for us, the stay at homes, the wear your mask, the washing of the hands, is there for a reason. It's there for your protection. It's there for others' protection. We talked about being asymptomatic. A person that's asymptomatic doesn't know they have the disease, but they're yet spreading it.
mm.
So my advice is stay at home. Stay at home. If you don't have to go out, do not go out. If you have to, if you must, please use all of the measures that are put in place for us today. It may save your life. It may save someone else's lives. Let us not be selfish and just think we can go out, because that moment you could snatch someone else's love life, someone else's loved one, and that's just not, it's not cool, man.
Yeah.
Listen, I can't stress enough how real this COVID is. It's unfortunate that our leaders of this country took it so um, as it was not so important. But this thing is very real, very real. I'm a survivor, and I'm not just a survivor because the Lord healed me, but I'm a survivor to let other people know. This is something that can be avoided at your cost. And
Absolutely.
secondly, and last, I just want to let the world know that God can do anything but fail. He did it for me, and he can do it for the next person. So if you have that family member, that friend, or someone that's there in the hospital or dealing with COVID, just say a word of prayer for them and know that God will take care of them.
Wow. There are rare times, Jamie, that I'm speechless. But this is one of those times. I'm just so grateful for the miracle that you are, and for your time and your sacrifice, and I believe you'll be talking about this for the rest of your life, and your son will be talking about this even after you and I are long gone. Because I don't know about you, but I'm going for 120 years. You know,
Okay.
so I'm planning to, if God gives me the health and strength, I'm planning to live to be an old man. But I believe that this is a part of your legacy, and that you're going to be able to help people. I also want to say, last week in our conversation on Facebook Live, we were talking about this COVID-19 pandemic and how I believe that we're going to actually be dealing with this for quite some time. I don't believe that we're going to it's just going to disappear in the next month or two and we won't hear of it again. I think that it's going to be some years that we'll be dealing with this. For some reason, I have no medical research. I have no proof. No one has talked to me. No one has said anything to me. But from the information that I'm gathering from people like yourself, healthcare workers, my friends, colleagues, listening to what they're saying on the news, the government, looking at the second waves that are taking place in China and the other countries and possibly will happen here in America.
Right.
I think that we're going to be dealing with the flu or the COVID-19 virus like we deal with the flu. And I think it's going to be something that we will have to contend with and that we will learn to manage as time goes on and we get more information. Have you thought about that in any way, or what are the implications in terms of where we go from here?
Or just on a lower level as myself. Yeah, like I said earlier, life as we knew it, I doubt if we ever get back to that.
Mm.
Because there are a lot of people who are not taking this serious, and that's going to be high risk for a lot of us who are really trying to take this serious.
Right.
And as like you said, I think it's just going to be something that's going to be part of us. Just as we get up and we put our deodorant on, we wash our face and brush our teeth, we'll be getting our mask. We'll be doing these things, I feel like, for a while. So it's going to become part of our lives. One of the things that was also instrumental in helping me was your sister. She's my doctor.
I
Dr.
didn't know
Williams.
that.
Dr. Williams is my doctor.
Okay, shout out to Dr. Valencia Williams. I'm sure she's watching. I hope she's watching. I'm not able to see the feed right now, but shout out to you, Dr. Williams.
And well, she asked me a couple of questions as I was coming out of my quarantine. Because once I left the hospital, I still had to be quarantined. And she asked me a couple of questions about my health, how I felt, any fevers, and headaches, any of those things. She's very caring, which let me know her position was, listen, if you're still experiencing these symptoms, don't bring it home to your family. Stay
Right.
there and quarantine some more
Mm.
until you're free of these things. But again, I was fortunate and blessed enough that I did not have any of those ailments that she was asking me about. And so when she said, I think you can come on home, man. Oh boy, I couldn't get in that truck fast enough.
Who came to
But
pick you up, Jamie?
I drove from New York, from Saratoga Springs to my home here in Portsmouth. 9 hours and 15 minutes.
Nonstop? Did you stop for a bio break or food or anything?
I stopped once. I was ready to get home. I left at 4:15, and I got here at 1:15 p.m. So
Wow.
I
Yeah,
was ready to get home.
you were on the move. You were on a mission.
Yes, I had to get home to my family, man. It's nothing like thinking you wouldn't see somebody again, and
Absolutely.
you know, I was just happy. But back to what you asked, I think this will be a part of our lives for a long time.
Absolutely. Absolutely. Jamie, I know you are still with your wife and your son, and I know that the hour's getting later there. So I don't want to hold you any longer, but I do want to appreciate you, and I join with you, as a person of faith myself. When I found out that you had contracted the virus, it was through Facebook. And my family and I, we have a WhatsApp group that we chat every day. From my mother and father, thank God they're both still alive and doing well, and all of my siblings. And we were just, when your name came across our feed that morning, and I believe it was my twin brother Mitchell who said, Jamie Smith has COVID-19, we need to pray for him. We all stopped what we were doing and we prayed for you as a family. And that, that's what family is all about, right? It's when everybody else is gone, when all else fails in your life, and I'm talking from my personal experience, family will be there come rain or shine, come hell, or as they used to say, the old folks used to say, hell or high water. Family is going to be there for you. And I'm grateful that your family is there, your mom. I saw your mom embracing you. I believe my brother sent a picture of your mom, even with her hand, one arm around you, the other one extended toward heaven. Just I'm grateful, for her baby coming home. And what an emotional time for all of us, even those people who are watching on Facebook Live. I've seen comments going across the screen as we've been talking, and I've tried my best to keep my emotions together so that I can continue to guide us through the conversation. But I can't express to you how grateful and appreciative I feel for your life. And I think we need to have this love extended one toward another, especially in a time like COVID-19. It's unprecedented. We've never seen anything like this before, in our lifetime, that is.
That's correct.
I want you to continue to stay healthy and safe, and we will definitely be in touch. Thanks for watching. Be sure to subscribe for more educational news, exclusive interviews, and more.